Hey guys, happy Tuesday. It's time for some more Tidbit Tuesdays. So this week I thought I'd talk about something. I've been getting a lot of phone calls for people moving from mainly different states here into our Austin area. And what many people do not realize is when they move, if they do not have employer-sponsored health care, you have to change your health care. So I say change it, you have to update the information. So again, depending on what type of insurance you have, if you have a marketplace plan, you absolutely have to go in there and adjust, enter your new address and update that information. And even though I had this happen with someone, they were still able to pick the same plan, but they had to update it and select it. They tried calling the marketplace because they didn't want to bother me. And I said, no, this is what I do. This is why you need to call me. Because they were kind of pressuring her into changing plans, and she was a little confused. So she called me and I said, no, let me look at it. Her address was updated, so I opted for the plan options, and lo and behold, the same plan she had before was still available. So we went ahead and selected that, so her coverage did not change. But people do not realize, especially when they're moving from out of state, how insurance varies. Marketplace insurance varies very much from state to state. A lot of states have their own exchanges and thereby have their own coverages. And so a lot of people in California has, of course it's California, so they have different rules. And there's different rules for what their coverage is. There's the federal level of what has to be covered, and then California has some additional rules of things that have to be covered. And so the coverages vary. Things that are available there are not available in Texas. And so it's super important before you move to maybe find out how it's going to affect your health care. If you have employer-sponsored health care, you're probably fine. I doubt very seriously you'd have to change that. But even if you're on Medicare, even if you move across town and change your zip code, you have to update that. Whether it's a private plan, you may be good. But again, we need to look at that. But certainly marketplace, ACA plans, any of the Medicare plans, the coverages vary greatly regionally and of course state by state, but people just don't think about that. And there's been a lot of not happy people who had what coverage they liked in a different state and they moved to Texas and it's not an option here. So it's very confusing to people because we have this marketplace where it's a federal program, so a lot of people assume all the same coverages are offered on that platform because it's federal. Well, it still varies state by state because the way insurance works. It's why when we have insurance licenses, we have to have a license in the state we write in because it varies by each state. That's something that there's not a federal insurance license that I could get and access to sell nationwide. I do have to be licensed in each individual state. So it's very interesting, the different plans that are available. I've helped people in many states, and seeing some of the coverages that are available in different states is quite interesting. Alabama, for instance, has PPO on their exchange, Blue Cross Blue Shield PPO, and that's not available in Texas. You can only get Blue Cross Blue Shield HMO in Texas. So at least in this area, I haven't seen any other ones unless I'm wrong. But of course, I only run quotes for people who call me. I haven't checked every zip code in the state of Texas, but it's something that you need to plan. The other thing that people don't plan for besides moving is when their status changes, and mainly that's getting married. What people do not realize is getting married does change, at least for the marketplace plans, changes your income because now it's household income. It's no longer just your income. And I did have a young lady a couple of years ago that didn't realize that, and she had a subsidy and was paying almost nothing for her health care. she gets married and she, does what she's supposed to do, goes in and updates her plan on the marketplace, and now her premiums are $300 a month. And she's like, but we pay our bills separate. And I'm like, well, if you're filing jointly, it counts. So that's something that people also don't think about when they're getting married or getting divorced. Your healthcare needs are going to change at that point too. You also do qualify for, it's a special event. Moving is a qualifying event because you have to look at different coverages, getting married, getting divorced, having a baby, or someone dies. Those are all qualifying events that give you a 60-day window to make changes to your health care. Super important, I think, to have an agent that has access to all the different platforms and that can look over things, help you find the lists where you can search for doctors. Because if you're moving from a different place, if you're moving zip codes, you may not have to change your doctor, but shocker, sometimes I've had this happen where someone moved across town and now the plan that they had is no longer available, and now they can't find a plan that their doctor accepts. So it's always good to check all this information out among all the other things you do when you're moving. Or on your list of, hopefully, if you're getting a divorce, you have an attorney that's going through all those things with you that you need to change, or there are possible changes because your status change. So hop on over to my page, Daycap Consulting. You can book an appointment with me and talk to me about some other things. There's many more videos over there that talk about various different topics. I look forward to seeing you guys next week. Peace out.